So what we've done, we put together a program where we can pool individuals and groups together into a large group. It's an association, non-profit, and it's member-owned. So it allows us to pool people together to get better benefits, better rates, greater volume discounts, those kinds of things. Now, when you buy insurance, any insurance, it doesn't matter, and I'm going to speak louder so that they can pick up on the tape, but you go into a pool. They underwrite you based on height, weight for health insurance, age, sex, number of children, marital status, whatever. But they give you a rate based on that. But with small group, what they do is they pull you out and make you your own little pool. And that way, if somebody in the group has a health problem, they rate everybody up for that problem. So you've been double rated already. And the reason they do that is because they can. When they did healthcare reform the first time, it allowed the insurance companies to do that. Who did it benefit? Insurance company. So the first thing we do, we eliminate that. So we put you back into a true group pool here so that you have those advantages. Now, when you pay your premium, do you have health insurance now?
No.
Okay. You've had health insurance though. Okay, when you pay your premium, it goes to the insurance company, they pay claims. What happens when you renew?
If you've made a lot of claims, they raise your rates.
What if you haven't made any claims?
Sometimes they raise your
They
rates.
raise your rates anyway. Right?
Right.
So, why?
Because they can.
Right, exactly right. Because they can. And that's the only reason. Well, the insurance companies charge between 30 to 40% just for claims administration. And so what we do, the first thing we do is buy wholesale. So we go to the insurance carrier and we say, we don't want you to administer the claims. We'll take over that.
Okay.
We'll also take over marketing. You don't want them to do any marketing. So what happens, you pay your premium. Now we use an HRA to administer our program. And I'll come back to that, but are you familiar with HSAs? Health Savings Accounts?
I've heard of them, I'm not really.
Cafeteria plan. That's where you can put money into an account tax-free and use it for medical expenses, out-of-pocket expenses, and it's tax-free to you. HRA and HSA, if you don't use it, it rolls over from year to year. So what we do now, part of your premium goes to the insurance company, part of it goes into the HRA, So it's growing and accumulating, and you can use it, and I'll explain this more in detail in a minute. But now what we do, we hire a TPA, that's a third-party administrator, to do the claims. And now we can process the claims somewhere between 7 to 10%. So we get an immediate savings. The way to track this so that you don't get rate increases is here. If you have a company, let's say this is a business, and there's some advantages to the association. Right now, if you're with a company and you quit or laid off or fired, the only benefit you have is COBRA,
Right.
where you can continue coverage. Well, here you can keep the coverage because even if you're laid off, you're still a member of the association. So you can keep your coverage as long as you want. So it's portable. Also, it covers pre-existing conditions.